While substance use happens in all sorts of levels, addiction is different. And what I try to change a lot about misconceptions about this is that substance use disorder is a chronic medical disease. And I think a lot of people in the medical field have this misconception that substance use disorder is a moral failing and that someone sort of chose to go down this path. But what we see over and over again is that this is a chronic medical disease and has a pathophysiology that's no different than cardiovascular disease. My name is Joseph D'Orazio. I work at Cooper University Hospital in the Center for Healing. I help patients in the hospital who are going through withdrawal, who have dependence to substances, treating patients with substance use disorders.
I went to this recovery house, and while I was in that recovery house, I started working, and I had met some people that were talking about a certified recovery specialist program. And I had no idea what that was, so I inquired about it. I learned about it. I took the course. And now I dedicate my life to helping people that battle substance use disorder. I worked at Temple for 2.5 years. I had met this doctor. His name's Dr. D'Orazio. He was amazing. He really taught me what it was like to advocate for patients to medical staff. The peer recovery specialist role is important in hospital-based services in general because it creates a safe space for the patients. It helps plant that seed for when they are ready. Having a peer recovery specialist breaks down a lot of the walls and a lot of the stigma. It helps advocate for patients that cannot advocate for themselves. I get the chance to train the staff in the emergency room on the proper language that we use with our population of patients. That's part of why I do it, to help break the stigma that they face on a day-to-day basis. And what makes it rewarding is, in the beginning of my journey, things like this didn't exist. People weren't in the hospitals helping me at my lowest point.
I have seen Becky engage with patients, whether she's engaged with them in an outreach position on the street or whether she's met them in the emergency department after an overdose, and then has held their hand and helped them navigate the system into recovery is really important. And she's able to engage with patients in a way that I'm not necessarily able to do. And her role in this as a holistic approach is really meaningful.
My name is Sarah Anderson, and I am hoping to become an emergency room physician. I really want to become an ER physician because at a baseline, I think it's important for everyone in a hospital to have the education and the understanding that substance abuse disorder is a disorder. For me, part of becoming an emergency room physician is also to be that first face that a patient sees and recognize that they are human and be the compassionate person that they need or advocate for them in whatever way is necessary at that time. I was raised to be a part of a community, and what that means is not just living there and going about your own business, but keeping your eyes open and recognizing that other people might be struggling.
We see oftentimes when people are just starting to engage with recovery, their lives are pretty chaotic and they can't plan an appointment a week ahead. And having a walk-in option is really great. Someone can have a thought like, I need help today, and can go and engage in a walk-in clinic. But if they needed to make an appointment today for another week, oftentimes we lose that opportunity for recovery. Having a mobile unit and meeting people where they're at is really important, especially for patients who are unhoused, who the lives can be pretty chaotic and difficult to manage day to day. And so being able to have a consistent place for patients to engage with care in the community is really important, especially with substance use disorder. We need to look at the holistic approach to taking care of patients, because it's not just the medical issues that people are dealing with. They're oftentimes dealing with other issues that will relate to their addiction.
I'm in charge of basically getting the meal site set up and getting the goods, the food, the clothing, procuring everything during the week, getting it all together in our storage facility. We surpassed 1 million meals in November of 2023. We do wound care on Saturdays. We have a lot of nurses and then a few doctors that come over. We treat about 20 or 30 wounds, and these wounds are pretty severe tranq wounds. One of the things that we give out is safe use kits. So you will get a straights kit, which is going to be generally 10 syringes, clean syringes with sterile water and a cooker and a tie-off so that people who are going to use, because of their addiction or otherwise, can use safely so that we're not introducing HIV/AIDS and Hep C and stuff like that into the mix.
Harm reduction allows people to get into recovery on their own terms without putting labels on what people should be. I was unhoused in this neighborhood. The people that came out and did this for me, it really meant a lot. I refuse to give up on anybody that's out there because enough people have done that already. The reason I do street outreach is because it's what was most helpful for me when I was unhoused in Kensington. I loved the people that came and gave us a peanut butter and jelly sandwich and water. It wasn't much, but it showed that people actually cared. So that's why I continue to do it. You don't need to tell me you want to go to treatment for me to give you a hot meal. It's a basic human right.
It's important to me that I spend my free time supporting my neighbors. My neighbors are those people who live in Kensington. They are still community members, whether they are housed or not. And so to me, I think it's incredibly important to take the time to give back to others.
Filianone is a nonprofit that is a community-based organization that does boots on the ground outreach, where we get wagons and necessary resources and we take them around Kensington and the rest of the city and hand them out to people in need. Everybody gets water, everybody gets socks, everybody gets t-shirts, everybody gets snacks, everybody gets toothbrushes, everybody gets resources on a daily basis that they need, that you don't think of.
Any given time, and we have 5 or 6 people behind the tables that were on the other side a year ago. It really reassures me that what we're doing is a great thing. Multiple generations of people coming to that side of the table and giving back what was given to them.
Lots of people have misconceptions where you need to hit rock bottom or that patients with substance use disorder don't recover. But where I sit, I see a lot of people who have been able to engage with care.
Recovery now is so much more accessible. It really is just don't give up on yourself. Keep believing in what your mission is and you can accomplish anything. I'm literally living proof of that.